धूल की ताल पे गा रे, नाच दिल झूम के गा रे, अपना हर दर्द छुपा के नाचे और सबको नचा रे, मुख पे घूंघट डाले नैना दो मत वाले, आज कोई चला है सज के पिया नगरिया रे, ये बंधन नाते सारे छोड़ के मनवारे. Hey everybody, this is Dr. Shoaib Durrani from Durrani's Dental Clinic. Get to know me more on FHM Pakistan. Well, while I was studying, I realized that oral hygiene is really ignored, and all over the world, other than Pakistan, people were very much interested in making their teeth clean and maintaining good hygiene. So I thought that I'm going to make a mark on the dental landscape over here, so that we can help people achieve good oral hygiene and good oral dental health. If I was not a dentist, I would probably be in some multinational as a marketing or a sales person, designing campaigns for them. Well, the main difference that we have is that we've designed the entire clinic based on a patient's experience. So from the minute that they enter, the smells, the sounds, the ambient environment that we've created will definitely reduce any patient's anxiety or fear of what they would generally expect from a dental clinic. And our motto is genuinely redefining dental experiences for the masses as well. So what I've noticed in the last 16 years of practice is that patients generally have a lot of fear because they don't know much about the experience that they're going to have. So one of the main things that we focus on is informing our patients and basically educating them about what the entire procedure would be like. We do practice profound anesthesia, which is a concept where we give a little more of anesthesia and we take our time for the anesthesia to take full effect. So there's no hurry, there's no hustle. We just generally make sure that the patient is comfortable before we even start a procedure. My target market is actually anybody who's been very scared of their dental treatment and very concerned about their dental problems. We aim to be accessible by everybody, but of course the way that can be done is that we spread more awareness that dentistry has completely changed due to modern techniques, due to modern latest advanced technologies. Things have gotten a lot better in the last 15-20 years, and we will surely ensure that your experience over here is always comfortable. I feel the biggest misconception is that people don't seek treatment if they have bad breath, if they have dental problems, bleeding gums. And the most easiest thing to do is get scaling done, where we remove the bacterial layer which is around the teeth. Some people think that is going to weaken the teeth, but actually it strengthens the gum, it strengthens the teeth, and it strengthens the bone that is supposed to give support to the teeth. I feel in the last 10-20 years, we have definitely improved as far as our dental services are concerned, but I think there's a very long journey towards meeting international standards as far as people seeking treatments are concerned. But I believe that private sectors have really upped their game, and they're really interested in giving very good quality treatment to their patients. There's only one vital point for client satisfaction, and that is to have a complete disclosure of their condition, explanation of the treatment, and making sure that they understand it. There are two different things. One is to explain something, and the other is to make sure that they understand what they're going to undertake. So the most important thing is communication, and that is the one and only key. Well, we opened our practice in 2019, and 2 months down, the COVID pandemic broke out, and I knew that when we set up the clinic, we were going to have optimal hygiene and sterilization standards, and we just had to sort of repurpose certain things over here, because our protocols and everything were up to standard. So the only thing that we had to do was that we changed our policy of having a lot of patients at one time. So now we only treat one family at one time, so that there's a closed group who's going to be treated, and then there's a 20-minute fallow time, which basically means that we disinfect all surfaces. There's no cross-contamination happening. A turning point in my life would be when I was working with Dr. Altamas at his private practice, and there were certain events that we used to hold. All I saw was that there's a guy who's in his mid 60s who works throughout the day, but at the same time he would continue getting education all over the world, and that sort of put things into my perspective, because I would generally think that I am very well read and I have information about a lot of things, but international exposure and continuous dental education is the key to remain at the top of your game. While working in one of the colleges, we used to hold a lot of events, and I do sing a little here and there, and so my students, they gave me a title which was Dentist by the Day, Rockstar by the Night, which was just hilarious because it sort of brought about my whole routine during those days. I play all musical instruments including the flute, but my favorite is definitely the guitar. It helps me complement my singing because rhythm guitars and lead sort of gives a certain feel to somebody singing and enjoying music. Well, while growing up, I listened to everything from 80s pop to death metal to heavy rock to rappers like Eminem and all those, and then Nusrat Fateh Ali Khan and all these qawwalis and ghazals. So my time growing up was a very, very, very musically rich time, because the quality of lyrics, the quality of musical compositions, the quality of singers and the composers was phenomenal. I'm a champ because I got selected for the national shooting team and then the South Asian Federation team where I represented our country, and I had the privilege of winning a gold medal and 2 silver medals for our country. It was an elevating experience because I put our country, Pakistan, on the map, and I choose to do the same for dentistry as well. I think everybody knows how to maintain oral hygiene because everybody understands now, compared to say 20 years ago, that they're supposed to brush twice a day and for 2 minutes, and they should floss their teeth. I just want everybody to understand that this is the simplest way to avoid oral disease. So if you brush twice a day and floss, you're really not going to have any dental problems. If you think you brush for 2 minutes, trust me, nobody does. So if you have a timer, you will realize that it does take quite a while to maintain good teeth and good hygiene.